My name is Logan Kolb, and I'm a board-certified dermatologist at Olmsted Medical Center. Dermatologists treat everything related to the skin, hair, and nails from head to toe, so whether it's hair loss, skin cancers on the body, or even toenail fungus, but there's a very wide variety of things we treat. Rashes like eczema, psoriasis, hidradenitis suppurativa, excessive sweating, hyperhidrosis, but a big part of our practice too is skin cancer screenings and finding and treating skin cancers with a variety of modalities. I became a dermatologist because I've struggled with a lot of skin issues myself since I was a kid. I grew up in a log cabin near Plainview, and it was always bone dry in the wintertime, so I really had to get good with my own skin care at that point, and struggled with eczema and psoriasis and some other things. And so when I got to medical school and started treating patients with skin issues in the family practice clinics, I could really relate to those patients a lot more and even give them tips that had worked for myself. And so I feel like that's helped me treat patients better in the long run. What I want patients to know about their appointment when they come to see us is to be sure to be specific when they actually make the appointment itself. So if you're coming for a skin cancer screening, it's best to focus on that issue. There are times where patients will schedule a skin cancer screening, but then they come in with a laundry list of other issues. And I say it's kind of like scheduling your car for an oil change, and then you show up and ask for the brakes to get replaced and look at the radiator and all these other things too. So it is best to do that up front, but we'll do best to address everything we can in a given visit. Within dermatology, we treat a variety of things from rashes, some cosmetics, and surgery too. And I think for me personally, I like to focus on some of the surgical treatments, especially for skin cancer. I did my training in Florida, and we treated a lot of skin cancer down there. And so whether it's excisions, starting to do Mohs surgery, and another new exciting treatment we'll be offering is superficial radiation therapy called SRT. And there's a new version of that where they can use an ultrasound to really find exactly where the skin cancer is and just treat that area. So you're leaving a lot of the adjacent normal skin alone. And so that provides really high cure rates, and that'll be a really exciting service that we'll be offering, not only to treat skin cancers, but also there's something called keloids, where a lot of times in patients of color, they can get these really large scars. And when you cut them out, they're more likely to come back unless you use that radiation therapy that we'll be offering. With just a few treatments after an excision of a keloid, we have much lower recurrence rates. So it's very exciting that we'll be offering that. So I think it is crucial to make a connection with every single patient that we treat as providers, just because when you have that connection, I feel like you're more apt to treat them like family. You know their family life, their hobbies. And so I feel that providers are more willing to go the extra mile for patients when you truly know who they are. And I think that also comes in return that patients trust their providers, and they're more likely to follow treatment recommendations that you make too. I have a lot of fun hobbies and interests outside of work, and so I am a father, and so I do like spending as much time as I can with my son and daughter that's on the way. I play bass guitar in bands, and I've done that for many years since college. I like to hike and bike and be active outside too. I love coming to work every day at Olmsted Medical Center because we truly have wonderful staff and wonderful patients here. I mean, you talk to a lot of staff around OMC, some have been here 10, 20 years, and I think that's a big telltale sign that they enjoy coming to work and enjoy doing what we can to help our patients in the best way that we can too. And so also I grew up in the area here, so I feel like I have a special connection and understand where people are coming from when they're coming from Rochester and a lot of the surrounding towns.